81. Nurses can administer expired medications in emergencies. True or false? Answer: false rationale. Expired medications may lose potency or become unsafe and should not be administered, even in emergencies, per medication safety and regulatory standards. 82. Elevating the legs reduces edema in patients with venous insufficiency. True or false? Answer: true rationale. Elevating the legs promotes venous return, reducing edema in patients with venous insufficiency as part of non-pharmacological management. 83. The nurse should interrupt a patient during therapeutic communication to provide education. True or false? Answer: false rationale. Interrupting a patient during therapeutic communication hinders active listening and trust building, requiring nurses to allow patients to express concerns fully. 84. A temperature of 36.5 degrees Celsius is considered hypothermic. True or false? Answer: false rationale. A temperature of 36.5 degrees Celsius is within the normal range, 36 to 38 degrees Celsius. Hypothermia is defined as below 35 degrees Celsius, requiring warming interventions. 85. Nurses are responsible for ensuring a safe environment for patients. True or false? Answer: true rationale. Nurses must maintain a safe environment by removing hazards, ensuring equipment functionality, and implementing safety protocols per patient safety standards. 86. All patients require a full body assessment every shift. True or false? Answer: false rationale. Assessment frequency and scope depend on patient condition. Stable patients may require focused assessments, while unstable patients need comprehensive ones. 87. The nurse should use sterile gloves for all wound care. True or false? Answer: false rationale. Sterile gloves are required for open or surgical wounds, but clean gloves are sufficient for chronic or superficial wounds, per infection control guidelines. 88. Pain management includes assessing the patient's cultural beliefs about pain. True or false? Answer: true rationale. Cultural beliefs influence pain expression and management preferences, requiring nurses to assess and incorporate them for effective, patient-centered care. 89. Incident reports are shared with a patient's family. True or false? Answer: false rationale. Incident reports are internal documents for quality improvement and risk management, not shared with families to maintain confidentiality and avoid legal issues. 90. A heart rate of 90 beats per minute is normal for an adult at rest. True or false? Answer: true rationale. A heart rate of 90 beats per minute is within the normal range, 60 to 100 beats per minute, for an adult at rest, indicating stable cardiac function. 91. Droplet precautions are required for all respiratory infections. True or false? Answer: false rationale. Droplet precautions are specific to infections like influenza or pertussis, while other respiratory infections, e.g., tuberculosis, require airborne precautions per CDC guidelines. 92. Fluid overload can be assessed by monitoring daily weights. True or false? Answer: true rationale. Daily weights are a sensitive indicator of fluid status, with a 1 kilogram increase reflecting approximately 1 liter of fluid retention, guiding fluid overload management. 93. Nurses can ignore a patient's refusal of treatment. True or false? Answer: false rationale. Nurses must respect a patient's right to refuse treatment, documenting the refusal and notifying the provider per ethical and legal principles of autonomy. 94. Proper hand hygiene includes drying hands thoroughly after washing. True or false? Answer: true rationale. Thoroughly drying hands prevents skin irritation and reduces pathogen transmission, as wet hands can harbor bacteria, per WHO hand hygiene guidelines. 95. Hyperkalemia can cause muscle cramps and cardiac arrest. True or false? Answer: true rationale. Hyperkalemia, high potassium, disrupts muscle and cardiac function, causing cramps, weakness, and potentially lethal arrhythmias or cardiac arrest, requiring urgent intervention. 96. The nurse should reposition a patient only when they request it. True or false? Answer: false rationale. Repositioning every 2 hours is standard for immobile patients to prevent pressure injuries, regardless of patient request, per Wound Care Guidelines. 97. Medication reconciliation is only performed upon discharge. True or false? Answer: false rationale. Medication reconciliation occurs at admission, transfer, and discharge to ensure accuracy and prevent errors, per Joint Commission patient safety goals. 98. A warm compress is a non-pharmacological comfort measure for pain. True or false? Answer: true rationale. A warm compress promotes muscle relaxation and blood flow, reducing pain in conditions like muscle spasms as a non-pharmacological comfort measure. 99. Nurses can share patient information with colleagues in public areas. True or false? Answer: false rationale. Sharing patient information in public areas violates HIPAA, requiring nurses to discuss patient details only in private settings to protect confidentiality. 100. The nurse should assess a patient's skin integrity during every bath. True or false? Answer: true rationale. Assessing skin integrity during baths identifies early signs of breakdown or injury, enabling timely interventions to maintain skin health, per nursing standards. 101. The nurse should use a clean technique for urinary catheter insertion. True or false? Answer: false rationale. Urinary catheter insertion requires a sterile technique to prevent urinary tract infections, as the procedure involves an invasive entry into a sterile body system, per CDC guidelines. 102. A patient's bed should be kept in the lowest position to prevent falls. True or false? Answer: true rationale. Keeping the bed in the lowest position reduces the risk of injury from falls, especially for patients with mobility issues or altered mental status, per Joint Commission safety standards. 103. Handoff reports should include only the patient's current condition. True or false? Answer: false rationale. Handoff reports should include the patient's current condition, medical history, recent changes, and care plan to ensure continuity of care, per SBAR communication guidelines. 104. Perineal care is only necessary for incontinent patients. True or false? Answer: false rationale. Perineal care is necessary for all patients, especially those with limited mobility, to prevent skin breakdown and infections, not just those with incontinence, per hygiene standards. 105. A pulse oximetry reading of 96% is normal for an adult at rest. True or false? Answer: true rationale. A pulse oximetry reading of 96% is within the normal range, 95 to 100%, for an adult at rest, indicating adequate oxygenation, per respiratory assessment standards. 106. Hypomagnesemia can cause muscle tremors and seizures. True or false? Answer: true rationale. Hypomagnesemia, low magnesium, disrupts neuromuscular function, leading to tremors, seizures, or arrhythmias, requiring magnesium replacement and monitoring. 107. The nurse should administer medications immediately after drawing them up. True or false? Answer: false rationale. Medications should be administered after verifying the patient's identity and the 5 rights, not immediately after preparation, to prevent errors, per medication safety protocols. 108. Relaxation techniques are effective for managing acute pain. True or false? Answer: false rationale. Relaxation techniques are more effective for chronic or mild pain, while acute pain often requires pharmacological interventions, per pain management guidelines. 109. Nurses must obtain a signed consent form for all treatments. True or false? Answer: false rationale. Signed consent is required for invasive procedures or high-risk treatments, but not for routine care like medication administration, per ethical and legal standards. 110. Reflective listening enhances therapeutic communication. True or false? Answer: true rationale. Reflective listening, restating or paraphrasing a patient's concerns, validates their feelings and fosters trust, a key component of therapeutic communication. 111. Contact precautions are only for patients with confirmed infections. True or false? Answer: false rationale. Contact precautions are used for suspected or confirmed infections, e.g., MRSA, to prevent transmission, as per CDC infection control guidelines. 112. The nurse should check the bed alarm for a patient at risk for falls. True or false? Answer. True. Rationale. Bed alarms alert staff to patient movement, reducing fall risk for high-risk patients as part of a comprehensive fall prevention plan per safety standards. 113. Vital signs should be taken only once per shift. True or false? Answer. False. Rationale. Vital signs should be taken as ordered or based on patient condition, often multiple times per shift, to monitor trends and detect changes per assessment protocols. 114. Proper body alignment reduces pressure on joints during patient positioning. True or false? Answer. True. Rationale. Proper body alignment distributes weight evenly, reducing pressure on joints and preventing discomfort or injury, per safe patient handling guidelines. 115. A blood pressure of 110/70 mmHg is considered hypertensive. True or false? Answer. False. Rationale. A blood pressure reading of 110/70 mmHg is within the normal range, which is defined as less than 120/80 mmHg according to the American Heart Association guidelines. Therefore, it is not considered hypertensive. 116. Fluid balance is monitored by assessing intake and output. True or false? Answer. True. Rationale. Measuring intake and output provides accurate data on fluid balance, detecting imbalances like dehydration or overload per nursing assessment standards. 117. The nurse should use a medication's trade name in documentation. True or false? Answer. False. Rationale. Documentation should use the generic name of medications to ensure clarity and avoid confusion, as trade names vary per charting standards. 118. Distraction is a non-pharmacological intervention for pain. True or false? Answer. True. Rationale. Distraction, such as music or conversation, redirects attention from pain, reducing perception, and is an effective non-pharmacological intervention. 119. Nurses can override a patient's advance directive in emergencies. True or false? Answer. False. Rationale. Advance directives must be followed in emergencies unless unclear or inapplicable, requiring consultation with a healthcare team per ethical standards. 120. Cultural competence includes using a professional interpreter for non-English speaking patients. True or false? Answer. True. Rationale. Using a professional interpreter ensures accurate communication and respects cultural needs, improving care quality for non-English speaking patients per ANA standards.